Good morning. I'm Kelsey Ruff-Smith, Director of Programs here at the Community Foundation for Ocala-Marion County, and joining me today is Dr. Downey from the Heart of Florida Health Center. Good morning. How are you?
Good morning. I'm
I'm
great.
so glad to have you here. Thank you for joining us to tell us more. For those who might not be familiar with Heart of Florida Health Center, can you tell them a little bit about who you are, what you do, the populations you serve, and the needs you fill?
Yes, thank you. Well, Heart of Florida is a federally qualified health center. We provide comprehensive primary care and all of those holistic services that go with primary care for the Marion County community. Our population pretty much is anyone in Marion County who needs health care. We take care of everyone, regardless of their insurance, regardless of their ability to pay. No patient is ever turned away. We offer medical, both adult and pediatrics, as well as dental and behavioral health services.
That's so fantastic. I didn't even realize that you guys had all of the behavioral health and the dental as well. So that's really quite a few needs that you have filled here in our community. What a critical and important service that you all offer for us. Now, with all of that going on, I'm certain that there's been an impact from the coronavirus and all of the fallout from the pandemic. What have been the biggest challenges for the organization with everything going on?
Wow, that's a loaded question for us. I mean, we are at a time right now in our organization where we are expanding. We just opened our new location that will start seeing patients tomorrow, as well as expanding our pharmacy services to multiple locations. And in the midst of COVID, we continued with the expansion. And so that has really been one of the big challenges to continue on course with our expansion, being able to offer all of our services under one roof and still do the necessary services for COVID. We started COVID testing. We implemented several activities to support social distancing, like telehealth services. We began providing many televisits. We begin doing it's been so much. We also
Yeah.
begin doing inmate health care. We contracted with the Marion County Jail to provide the health care for the inmates in the Marion County Jail. And so all of that happening in the midst of COVID has been a challenge. But if I could say one thing, one of our ongoing challenges does continue to be behavioral health resources. Many of our patients have some type of mental health issue. Some of the patients in the jail have mental health issues, and just having resources for those patients to support their health care has been a big challenge as well.
I can imagine, the mental health community in general is generally underserved as far as, having enough resources to meet the appropriate needs. So I really commend you for tackling that head on and recognizing that challenge and knowing that there needs to be work to advance there just to improve for a better community for all of us. So personal thank you and my appreciation for picking up that flag. That's something very near and dear to my heart as well. It sounds like, though, that you've had a ton of challenges, but also several things to be proud of. Can you tell us a little bit more about the highlights of COVID and the big things that you've done in light of this pandemic?
Yes, well, we were one of the first testing sites in Marion County. We established a drive-through testing facility at one of our sites, and we completely dedicated all of the staff for that site to testing. And it gave us the opportunity to invite all of Marion County in on another level. We took care of patients even if they were not assigned to us, if they had another primary care provider, but they really needed to be tested for COVID. And so we're really excited about getting prepared for what could happen in the future. And so we're prepping for the possible second wave. And so we're excited that we're going to be able to meet this head on because we've had the opportunity to go through those workflows already. So I think it's been a really good success. And we were able to keep our staff and our patients safe through all of this.
That's amazing. And I mean, what a what a hard task that is to undertake in the first place, completely. Um, Now, with everything that's going on, all of the stuff that you're having to work through right now, what would be the best way that people could help you? Or is there anyone specific that you can think of that you would need help from today?
Wow, that actually goes right back to that behavioral health. We are expanding our behavioral health department, and we're looking for behavioral health counselors, LCSWs, social workers, case managers, anybody who's interested in working with this population, working with a vulnerable population being the inmates. We are looking to support with more people to provide therapy and counseling, and as well as helping them transition back into the community when they are released, keeping their mental health needs met and being able to continue getting medications and therapy. So that would, I would say, would be our biggest need. If people had resources, whether it be knowing a funding source, or if someone is in that field and wants to come and join our team, that would be wonderful.
That sounds great. So anybody who's interested, what would be the best way that they can reach out and contact you, Dr. Downey?
They could call us. Our main line is 352-732-6599, and they could ask for human resources. And they can also check out our website, which is myhfhc.org. And that's where all of the positions are listed, but they could reach out by phone as well.
That's fantastic. Is there anything else that we can add to this message to send out to people to let them know about Heart of Florida?
Well, our new site will start serving patients tomorrow. We're at 2553 Silver Springs Boulevard. And so we are welcoming anyone who doesn't have a primary care home and is looking for holistic care to meet the needs of their family.
That's fantastic. And I know that there are several people looking for that right now. So I'm certain you're going to get a bunch of people tomorrow when those doors open. And I'm so excited to see this wonderful new facility open up. It's going to be great.
It will. Thank you.
Yes, of course. I hope you have a great day. Please stay safe.
Thank you. You too.
Thanks.
Bye.
Bye.